Hi, everyone. Welcome back to the Healthcare Horizons podcast. Today, we're diving into psychotherapy. If you're studying for exams or just curious about how therapy works, this episode will give you a clear, approachable overview of the different schools of psychotherapy. Think of it as a guided tour, less like a textbook and more like a conversation. Psychotherapy spans a wide spectrum. On one end, we have psychoanalysis, which is all about uncovering unconscious conflicts. On the other, there's supportive therapy, which emphasizes encouragement, empathy, and coping strategies. Most approaches fall somewhere in between, mixing insight with practical support. Let's start with the classic, Freud's psychoanalysis. Here, the focus is on repressed thoughts and family dynamics. Traditional analysis is intense, several sessions a week for years, with the therapist often out of sight and neutral. Key ideas include transference, where patients project old feelings onto the therapist, countertransference, which describes the therapist's reactions, resistance, blocks to treatment, and free association, saying whatever comes to mind. Over time, new branches emerged: ego psychology, object relations, and self-psychology. Not everyone wants or needs years of therapy. Expressive or insight-oriented psychotherapy keeps the focus on personality and relationships, but in a more direct, face-to-face format. Then we have brief psychotherapy, usually 12 to 20 sessions. It's highly structured, works best for specific problems, and includes homework. This makes it accessible for people who need focus and efficiency. Next is interpersonal therapy. Originally developed for depression, IPT highlights the impact of relationships on mental health. It zeroes in on 4 areas: unresolved grief, disputes, life transitions, and social deficits. For someone going through a divorce or job loss, IPT helps clarify feelings, improve communication, and build healthier connections. Supportive therapy is less about digging into the past and more about building resilience in the present. The therapist is active, empathetic, and encouraging, making it a great option for lower-functioning patients who may struggle with reality testing or impulse control. Goals include reinforcing strengths, reducing distress, and improving coping skills. Shifting gears, let's talk behavioral therapy. Here the focus is on actions. Techniques include systematic desensitization for phobias, flooding for anxiety, and positive reinforcement like token economies. Other forms include EMDR, eye movement desensitization and reprocessing for PTSD, and dialectical behavior therapy, DBT, designed for borderline personality disorder, which blends CBT with mindfulness and emotion regulation. A special branch is biofeedback, where patients learn to control automatic body functions like heart rate or muscle tension using monitoring devices. It's been shown to help with migraines, high blood pressure, and even asthma. Now, probably the most famous, cognitive behavioral therapy, CBT. The core idea is that thoughts, feelings, and behaviors are connected. By identifying and challenging distorted thoughts, patients can change how they feel and act. CBT highlights the cognitive triad, negative views of the self, the world, and the future, often central to depression. It's structured, time-limited, and homework-heavy. The ultimate goal is to teach patients to become their own therapists. Applications are wide: depression, bipolar disorder, panic, OCD, PTSD, eating disorders, substance abuse, psychosis, and more. Therapy doesn't have to be individual. Group therapy brings people together with shared goals. It provides empathy, cohesion, and a sense of universality, reminding people they're not alone. Groups can be supportive, psychodynamic, CBT-based, or inpatient-focused. Finally, let's move beyond the individual. Family therapy views the family as a system and works on roles, communication, and boundaries. Approaches include behavioral, narrative, Bowen systems theory, and psychoeducation for illnesses like schizophrenia. Couples therapy helps improve communication, accountability, and attachment. It's best used when both partners are motivated and not in cases of abuse or severe instability. Techniques include role-playing, active listening, and sometimes paradoxical interventions. So, what's the big takeaway? Psychotherapy isn't one-size-fits-all. Psychoanalysis digs deep. CBT gives structure, supportive therapy builds coping, IPT focuses on relationships, and family or group therapy expands the lens. Each has its place depending on the person and the problem. That wraps up today's walkthrough of psychotherapy. I hope this episode gave you a practical map of the landscape. Thanks for tuning in. And remember, whether you're studying for an exam or just building your understanding, Knowing how these therapies work can deepen your empathy and insight into the healing process. If you found this episode helpful, don't forget to like, comment, and subscribe to our channel.